I'm Dr. Jaspal. I'm a resident obstetrician at the Park City Medical Center under the Sime Darby Healthcare. July is the International Cord Blood Awareness Month, and so I've been asked about cord blood in my practice. I mean, I do have patients coming to me asking me if it's beneficial or if they should store cord blood, and so my reasoning behind this is very unbiased. I'm not here to ask them to save their cord blood or not to save their cord blood. I think that a decision has to be made after being informed of the choices. Cord blood has its benefits. It's been used to treat hematological disorders, metabolic disorders, and immune disorders generally. Even if it's being used for their family, the numbers may be small. Having said that, there are a certain number of diseases, like for example thalassemia, where this is being used quite largely. The advantages of cord blood over the other forms of stem cell collection, like the bone marrow or peripheral blood, is that it's easy to collect, it's easy to store. There's less chance of infection, and of course there's less chance of graft versus host reactions when they are being transplanted. The disadvantages, as I mentioned earlier, would be perhaps it may not be useful for everyone. There's no reliable estimates as to what percentage of individuals may actually find it useful, because it is if you are suffering from a cancer disease or from a genetic disease, then the blood that you take from yourself will obviously have the same genes and may not be then useful. So when the mother comes into labor, the mother usually brings her own kit for collection of the cord blood, and prior to that, a discussion is probably had with her obstetrician about her interest in collecting cord blood. And generally, in most hospitals, most obstetricians would be happy to oblige this service. After the delivery of the baby, whether it's a normal delivery or cesarean section, the cord is cleaned with an antiseptic, and then the blood is allowed to be let out into a bag where the blood is where the cord blood is actually collected. The process may take about 5 minutes to complete, and this process is not at all harmful to mother or baby and is absolutely painless. Although collection may be easy, there are times when we are unable to collect the blood. The mother may have had an emergency situation wherein collection of the blood may become difficult if she's bleeding, and the choice would be left to the obstetrician at that point of time whether he has the time to wait to collect the blood from the placenta before it's delivered. The risk of infection to the cord and then to the blood may subsequently result in it not being used, and I believe the companies that will be looking at it will look closely for such situations. Stem cells has been around for a long time, and I think the first stem cell transplant was done in the late 80s. And my understanding is correct. Then in Malaysia, we also had a successful stem cell transplant in the 90s for thalassemia. Over the years, stem cells being researched in a lot of grants have been available in all over the world for stem cell research, and it's being used to cure many more diseases. But I think that we're still waiting more confirmation before we can actually bring this out to the public. I think that the public banking would be very beneficial if at all you are considering cord blood storage, because it can be used for an allogenic transplant to any individual required, and it's of course free of charge. Our public cord blood banking through the Pusat Darah Negara has been initiated, if I'm not mistaken, early 2000. However, if you have a need to store it privately, then you need to consider perhaps if there is a family member that would actually benefit from which actually has a disease that would benefit from having collected this cord blood in the future. Patient should make its own informed decision after researching or finding out a lot more about the use of stem cells, and perhaps when he has further more questions to ask, he can discuss it with his doctor.